Hi, my name is Nicholas Yu, and I'll be teaching you about the MARRCC assessment tool. The MARRCC assessment tool that I'll be teaching you about stands for Measurable Assessment in Recreation for Resident-Centered Care. This tool is a standardized clinical assessment tool that is computer-based, developed for long-term care. This tool is used for assessing the general health status and the physical, cognitive, and psychosocial needs of clients as connecting to their ability to engage in leisure activity. Let's move on to the purpose. The purpose of this tool is to provide recreational therapists with an assessment of a client or resident's functional level in each of the 4 categories. These 4 categories are physical, cognitive, social, and emotional, all relating to recreation participation. This assessment is an indicator of functional skills, and it shows the resident's ability to engage. These 4 categories that I explained earlier are important for 3 reasons. The first reason is because these 4 categories, physical, cognitive, social, and emotional, are used to develop an assessment-based understanding of the client. The second reason is it is used as an assessment of functioning of the client, and it is an accurate indicator of the ability to engage in numerous leisure activities. And lastly, the third reason, it allows the recreational therapist to focus on assessing the needs of the entire individual rather than focusing on a disabling condition. So the target audience. There's no specific target audience that this tool is used for, no specific age. It is used for all residents when you can identify their current interests, abilities, and needs relating to recreational activity. Let's move on to the overview. The MARRCC assessment tool comes in multiple parts. The first part is leisure ability model, and the second part is the model of selective optimization and compensation. So let's first talk about the leisure ability model. Within the leisure ability model, there are 3 parts: functional intervention, leisure education, and recreation participation. So leisure ability model. These 3 factors that are under the leisure ability model represent an assessment of needs and anticipated outcomes. This model is used to assess the functionality and limitations of a disability or illness. The related factors that are connected to this model are the leisure-related knowledge, attitude, awareness, and abilities. The information on these disabilities or illnesses are then used to make a program intervention. These interventions are outcome-oriented, and they correlate to the limitations of the individual. The next part of the MARRCC assessment is the model of selective optimization and compensation. This model is a developmental theory of aging and adaptation. This model focuses on the domains of functioning that matches environmental demands with the resident's motivation, skills, and abilities. Based on the guideline of this model, that successful aging is a process that connects to 3 components: selection, optimization, and compensation. The selected part refers to the specific variety of an individual's life due to a decrease in functional ability. The decrease in functional ability comes from the impairment of the individual. The second part, optimization, refers to the combination of personal strength and ability, as well as environmental resources that an individual uses to engage in leisure and life pursuit. Lastly, the third, compensation, refers to the use of psychological cues, social/environmental adaptation, and technological adaptive devices to compensate for functional abilities and behavioral capacities of an individual. So as a whole, it describes a lifelong process within which individuals pursue their own well-being. So let's move on to the development of the MARRCC assessment. The whole MARRCC assessment consists of an initial assessment, annual/change of condition/readmit assessment, quarterly progress note section, and a care plan development section. So let's start off with the first section, initial assessment. So the purpose of this assessment is to gather information about the resident's past and present regarding their interests and functionalities. With this information, the recreational therapist can accurately distinguish the resident's many functional abilities and functional interventions. Now let's move on to the annual/change of condition/readmit assessment. So the purpose of this assessment is to track and monitor changes in a client's functional level and needs. This also helps with modifying a client's recreational program in response to these changes. And then let's move on to the last two, care plan development, and quarterly progress note section. This section helps the recreational therapist develop a measurable goal for the client. This section also helps assess and evaluate the client's recreational plan as they are monitored at a constant rate. Let's move on to talking about something called the domain scale. Another factor for this whole MARRCC assessment is called the domain scale. This scale is used to measure the resident's function in the initial assessment and the annual/change of condition/readmit assessment. Within each assessment, there are 4 types of domain scales: physical, cognitive, social, and emotional domains. These 4 domains are incorporated into the MARRCC assessment for 3 reasons. First, the assessment of each of these 4 domains allow the recreational therapist to develop an objective. The second reason is that it provides an indicator of that resident's ability to actively engage in leisure pursuit. And lastly, the third reason, it allows the recreational therapist to more accurately assess the person as a whole. So these 4 domain scales are composed of 10 items, with each its own indicator. Each item represents either a strength or a limitation related to one of these 10 domains. These indicators provide measurement for each of the domains. The domain scales have 2 purposes. The first purpose is to be able to place the residents in the appropriate recreational program. The second purpose is that it provides the recreational therapists with a detailed list of the resident's strengths and limitations. These domain scales list 10 items, and within these 10 items, they are split into 3 sections. The first section, Section A, has 3 items that correspond to high functionality. Section B, the second section, consists of 4 items that correspond to moderate functionality. And the last section, Section C, consists of 3 items that correspond with low functionality. The grading of each of the 10 items are marked true or false. If it is marked with true, the resident meets all the minimum requirements of the indicator. If the item is marked false, it means that the resident did not complete the requirements of the indicator. Then, with these scores, they are assigned a score based on how many items were marked true or false. The scoring for this assessment means that the higher positive number that you receive, the higher functional abilities a resident has, and the lower number that you receive means the opposite. Now we're going to take a look at the actual MARRCC assessment tool. As you can see here, this is the initial assessment that you start off with. You list your name, your birth date, and your diagnosis, primary contact/relationships, medication that could affect leisure functioning, advance directions, and allergies. All general information. Then the next section below that is called dietary, which is quite self-explanatory. It asks you if you have diabetes, mechanically altered diet, tube feed, or doctor approved for alcohol consumption, stuff relating to your dietary consumption. And then after that, it asks you needs assistance to eat and additional consideration. After dietary, there is a section called Special Considerations/Safety Rules. It asks you things like, are you physically aggressive at times? Do you have severe visual impairments? And if you require direct supervision when out of the facility due to cognitive deficits. These questions are to help better get to know the resident and understand if they require assistance in anything that they do. Then, after the special considerations/safety issue section, there's a section called prior life roles/routines. This is about your prior occupations, any clubs or organizations that you were part of, or a customary routine that you had. And then the last part is additional information that the resident wants to add if necessary. The next section, or the next slide, is also the initial assessment. This section asks you about your past leisure participation patterns, attitudes, and awarenesses, personal favorites relating to leisure participation, and your preferred activity environment. Okay, next we move on to the section called Recreation Change of Condition. This section is to determine what 4 functional domains you want to improve on. So the functional domains are cognitive, physical, social, and emotional. After, it asks you what you want in a participation pattern, whether you want to change the patterns or if you want to have a specialized program to meet your specific needs. Next, we move on to the Recreation Quarterly Progress Note. As you can see, there are 4 sections in this Recreation Quarterly Progress Note. The first section is Participation Patterns. Second section is Recreation Narrative Notes. And third section is Goal Obtainment. And the last section is Recreation Plan. So this whole section is for the recreational therapist to fill out about the client or the resident. So the next section is called Generate Resident Groupings. So in this section, there are a lot of different components. There's group by domain functional levels, group by goal attachment, group by additional information, and group by participation patterns. And below that, there's group by activity preferences. And there are a lot of different sections for activity preferences. There's cognitive, social, passive activities, physical, spiritual/emotional/creative, social, passive activities, physical, and lastly, spiritual/emotional/creative. So a couple of these activities are maybe reading, jigsaw puzzles, museums, shopping, card games, socialization, volunteer, help others, listening to music. So the recreational therapist would fill this out with the observation of the client and their functional ability. So moving on, the next slide is an actual sample recreational assessment, initial assessment through the cognitive domain. And as you can see, like I mentioned earlier, there are 3 sections, A, B, and C. A has 3 questions, B has 4 questions, and C has 3 questions. And as you can see there, all 3 are marked true for A, all 4 are marked true for B, and all 3 are marked false for C. And as you can see, these questions are able to express choices and make decisions known, able to read for pleasure, able to follow verbal directions, able to focus attention, functional questions like that. And next, we move on to another sample. It's a recreational sample goals with sample interventions. And as you can see, the recreational therapist took some notes about this client. During activity participation, resident will respond to social communication as evidenced by any of the following. So eye contact, smiling, responding verbally, responding non-verbally. And the next section, in the notes, it says, during activity participation, residents will respond to sensory stimulation as evidenced by at least one of the following. So this is all to get a better understanding of the residents' abilities, functions, and what they look for in a goal or personalized goal. Without further ado, thank you for listening to my presentation on the MARRCC assessment.